Hi, welcome to Better Longer. My name is Dr. Marc Demers, and I am a board-certified surgeon, surgical oncologist, and NAMS certified menopause practitioner. In previous videos, I've tried to elucidate what visceral fat is and what the dangers of visceral fat are. In this video, I really just wanted to summarize the kinds of things that need to occur for someone with high levels of visceral fat to combat this problem. First of all, there is no single pill, there is no magic supplement, there is no unique exercise that will spot reduce visceral fat for you. You cannot do that. Visceral fat is nothing other than the visible expression of a metabolic dysfunction that can include type 2 diabetes, prediabetes, insulin insensitivity, and even worrisome things like non-alcoholic liver failure. Visceral fat is a risk for early heart attack, stroke, dementia, and other consequences of significant metabolic dysfunction. If you have high levels of visceral fat, getting rid of it involves nothing less than a complete lifestyle change and making elimination of visceral fat part of your life's work. Things that I suggest are these. Number one, know your enemy. A good thing to do as you embark on a program to reduce your levels of visceral fat are to find out how much visceral fat you have. And the most accurate way to do this is to obtain a DEXA scan, which will show you not only your bone health, not only the amount of muscle you have, but also the amount of fat you're carrying around, including the amount of visceral fat that you have. So job one is to find out how much visceral fat you have so that you can measure this as time goes on to see if you are making any progress at all. You have to come to grips with the fact that reduction in calories and reduction in your carbohydrate intake has got to be part of the process. If you're someone who still is drinking regular sodas, if you're having a few beers at the end of the day, if you just cannot live without those potato chips, you are probably not going to meet with success. Those harmful carbohydrates and processed foods have to go. Additionally, you should be comfortable with the idea of going for periods of time without food, such that putting off eating at all during the day until noon or afternoon can make sense, that you don't need a snack between meals. Next, you need your muscles to become your greatest ally. And to do this, you need to use them. You need to use them in the form of plenty of zone 2 aerobic activity, which I have previously described elsewhere. And you need to enlarge the capacity of your muscles to do work, which includes weightlifting and other forms of resistance training. Now, these are difficult things to imagine if you have significant visceral fat and have never exercised. But one thing that anyone can do at the start to make sure that their muscles are up to the job is to see if you are deficient in testosterone, if you are postmenopausal, because if you are lacking the hormonal environment conducive to developing muscles, that you simply will never develop the muscles you need to help you combat this potentially deadly complication of metabolic dysfunction called visceral fat.